Hello, welcome to today's episode of the Medical Mind Quiz. Today we are being graced with two intelligent minds from. We have an interesting contest coming up. Fun fact, our contestants are from St. Augustine's College. So let's welcome our contestants here. Okay, now let me allow these handsome gentlemen to introduce themselves.
Hello, beautiful people. My name is Osborne Wezania, the fourth year medical student from University for Development Studies, Tamale. Funny enough, I'm here with my small boy, Emo, from way back St. Augustine's. Well, all Chris Boy Hen was my dom junior.
Osborne, I'm not going to fall for your mind games. I'm not going to be intimidated at all. So my name is Emil Abagri. I'm a fourth year medical student at the University for Development Studies. I'm so ready for action.
You can see the heat now. Yes, that's my class. On a good day, if you are getting 75, be assured that you are the last person in the class. That's the heat we live in. Today's contest, we come with 2 rounds. The first one has to do with time questions. Individuals are given 2 minutes to answer 10 questions. Contestants are allowed to answer as many questions as possible they can within these 2 minutes. The second round is the speed race, and the first person to answer it correctly takes the mark.
Oh, I'm ready.
Wow. So we will start with Emo. Emo, your question. What hormone is secreted by the parafollicular cells of the thyroid gland?
Calcitonin.
Okay. So what is the first stage of the thyroid hormone synthesis?
Okay, so it's iodine uptake.
Okay, all right. Or iodine trapping. So once iodine is inside the thyroid follicular cells, what transporter takes it into the lumen?
A sodium iodine transporter.
No.
Or pendrin.
Okay, it's pendrin. So mention one hypothyroid emergency.
Okay, cold intolerance.
No, do you have any idea?
Yes. Mexidimacomo.
Okay, all right. So mention 2 causes of secondary thyroid toxicosis.
Okay, so we have excessive iodine intake, and then also taking of thyroid stimulating drugs.
Okay, I'll give it to you. The excessive cold mixture intake is called the based dose thyroid toxicosis. Okay, so a thyroid function test has increased TSH but low levels of free T3 and free T4. What will be your diagnosis?
Increased TSH. I would go for hypothyroidism. That's a simple goiter.
Okay, all right. What is the final stage of chronic liver disease?
Liver cirrhosis.
Okay. So mention 2 genetic causes of chronic liver disease.
Genetic causes. I would go for hemochromatosis and Wilson's disease.
Okay, you're right. So we have cystic fibrosis, collagen storage disease too as part of it. So mention 2 physical examination findings in a patient with chronic liver disease.
Okay. So you may find the patient having a distended abdomen as a result of ascites, and then you might also find findings of yellowish eyes or mucosal surfaces. That's jaundice.
Okay, you can find jaundice. So they can be xanthelamus, uterine contracture, parathyroid enlargement, spider name. So explain why gynecomastia occur in chronic liver disease.
Okay. So gynecomastia is just the enlargement of the breast tissue, right? And so I'm sure that's going to be as a result of an increase in estrogen secretion.
Okay, I'll give you half of it. It's actually. Do you have any idea?
Yes.
Okay, so
in chronic liver disease, what happens is that estrogen is supposed to be synthesized and broken down by the liver. Now, because the function of the liver is compromised in chronic liver disease, the amount of estrogen in blood plasma increases as a result of time. So then the estrogen now moves to the breast tissues, causing engorgement of the breast tissues and its enlargement.
But that's what he said, right? So what I was looking for was the estrogen and androgen ratio. There is an increase estrogen to androgen ratio. Now to Osborne. Osborne, Question one. So, what is the function of the follicular cells in the thyroid gland?
The follicular cells in the thyroid gland is responsible for the production of thyroglobulin, which in essence helps in the synthesis of the various thyroid hormones.
Okay, you're right. So, mention one chemical substance or drug that inhibits the iodide transport or iodine trapping.
Perchlorate or pertechnetate.
Okay, you're right. What enzyme deionizes tyrosine, that's T4, into T3?
Okay, so we have 5' deiodinase.
Okay, all right. So mention two drugs used for making patients euthyroid before surgery.
Okay, so first of all, you are supposed to give the patient propranolol, which is important to help in the various toxic symptoms, and also you have to give carbimazole.
Okay, carbimazole, you're right. But next time, please speed up. Okay.
Yes,
So
please.
mention two complications of thyroidectomy.
Okay, so there could be excision of the parathyroid gland if not taken, and also there could be excessive bleeding because of the rich blood supply to the thyroid gland.
Okay, so hypoparathyroidism. So a thyroid function test with low levels of TSH and only free T3 levels increase. What will be your diagnosis?
My diagnosis will be hyperthyroidism.
Okay,
Okay.
okay, it will be hyperthyroid. By which type? Can you just?
Okay, hyperthyroidism with a toxic.
Okay, okay, I'll give you half. But what I have is isolated T3 thyroid toxicosis.
Okay.
Uh-huh. So, mention two non-genetic causes of chronic liver disease.
Two non-genetic causes. Okay, so we could have non-alcoholic fatty liver disease. We could also have alcoholic hepatitis.
Okay. So, what explains hematemesis or melena in chronic liver disease?
In chronic liver disease, there is increase in portal hypertension, which in turn causes the collateral veins to become tortuous. Now, these collateral veins are found at various photosystemic shunts, and because of where they are, especially in the esophagus, they might cause hematemesis, which is vomiting of
Okay.
blood, and also melena because of their presence at the rectal.
Okay. So, as a
Rectum.
result of these ruptured viruses, thank you. So, mention two complications of chronic liver disease.
Okay, so for the complications of chronic liver disease, you could have how did I just go blank?
Okay. So, ML, you have any idea?
So you can have bleeding disorders and then chronic kidney disease.
You could also have hepatorenal syndrome, which is one of the main complications.
Okay. And also, you have hepatic encephalopathy.
Hepatic.
So, the last question. So, at what duration can you diagnose chronic liver disease?
After 6 months.
Okay, all right. So, that's the end of the first round. Let's move on to the speed race. So, as we are starting with the round two, contestants will raise their hand. Like, raise your hand. That way, when their answer is ready, so that I'll allow them to answer the question. If you don't raise your hand and you answer, it will be nullified. Question one. What enzyme facilitates the oxidation of iodide to iodine? Yes, Osborne.
TPO or tyrosine peroxidase.
All right. Question two. Mention one hepatotoxic drug.
Amiodarone.
Amiodarone. All right. An abnormally enlarged thyroid gland is called
Goiter.
Question four. What is the most frequent cause of chronic liver disease? ML.
Alcohol use disorder.
All right. Now the final question. A 45-year-old woman presents with complaints of fatigue, weight gain, intolerance to cold. Yes,
We have hypothyroidism.
okay, you're right. But are you magic? Okay, so to the viewers now to the viewers out there, with this clinical scenario, how will you manage the case?
Finish the questioning.
Okay, okay, the clinical scenario was a 45-year-old woman presents with complaints of fatigue, weight gain, intolerance to cold, and dry horse hair. On examination, you notice puffy facial features, periorbital edema, and slightly enlarged thyroid gland. Blood test reveals elevated TSH levels and low free T4. So, based on this clinical findings, you were supposed to give the diagnosis, which you did with hypothyroidism. Now, you have to manage this case. So, to the viewers out there, let me know how you manage this case in the comment section. So we finally come to the end of today's contest. That's really a fierce and intense one, of course. Thank you, contestants, for being part of today's show. I really appreciate it. Please don't forget to like and subscribe. Bye bye.